CataractCoach.com resident stop and chop review. So this Brazilian resident performs case number 128. So we're seeing the case here. Looks like this resident's very smart and using an adapter to mount the cellular phone camera to the oculars of the scope, maybe the assistant scope. And that looks really good. That's a reasonable cataract. Looks like a little on the soft side. So let's see the stop and chop technique here. We've zoomed right ahead to the phaco probe in the eye, and let's see the initial groove. Now, the nucleus is on the softer side. Be careful not to put too much phaco energy in the eye. Be cautious when creating these grooves. So a little bit of energy going in here, and that looks like a nice groove. I like the starting of the groove sub-incisional, which is being done here, and nicely grooving down the middle, slightly widening the groove. I like that as well. And now going a little bit wider on that, rotating the groove 180, and continue to sculpt this groove, looks like. Good job. By rotating at 180, you can get that former sub-incisional area and do a little bit more grooving there. And with a softer nucleus, you may have to groove more. And now, beautiful split. Very nicely done. I also like that the draping is pretty good, all the lashes out of the way. I like the incisions nice. I like the rexus looks good. This is a nice looking case so far. Not sure why the doctor came outside the eye here. Let's see, putting in some more viscoelastic perhaps. And now once you have the two halves done, you need to just bring up each half. So back into the phaco probe. Here comes the chopper again. And I don't like these ball tip choppers, but it's a reasonable approach, especially for a beginning surgeon. I don't mind using that. You figure out what works best in your hands. And now, the key with the softer lens is really getting that piece up without buzzing through it. You don't want to go through the piece and nail the posterior capsule. So I like this rotational technique to find an area that has a little bit more substance so they can vacuum into it. And it's a little bit more challenging here. So here's where I'd get that chopper around it. That's what I'd do. Get the chopper around that lens equator and bring up that piece. That makes it a lot easier. Sometimes in these cases, if they're too soft, when you apply the vacuum holding power from the phaco probe, the piece will just kind of erode away and you'll lose that grip. So sometimes you just have to go behind the piece with the chopper and bring it up. And once you've created a little bit of room, now the other pieces can come up quite nicely. So in this one, you really don't have to do much chopping. It's once you have the two grooves, each piece can be brought up and easily emulsified because this is a relatively soft cataract. So in a case like this, I think stop and chop is a very reasonable approach. With more practice, this is a case where I'd like to slightly prolapse out of the capsular bag, what I'd call a flip and chop or tilt and chop. Get it a little bit out of the capsular bag first, and then I can get the chopper and split the nucleus up into smaller pieces. So here's the remaining heminuclear piece, chopper going behind it here. You can try a little chop if you want to, but more importantly, just to hold the piece so you can occlude the tip of the phaco probe with that material and aspirate it. And I like how the surgeon's taking his or her time and being very cautious here during this part. Because a soft lens like this, you may be more likely to nail the capsular bag because you can go through the nuclear piece because the density is so low relatively quickly. And so here at the end, removing most of that lens material, now maybe getting out a little bit of that lens cortex, and then switching over to the IA probe. So definitely something you can do. You definitely have to learn stop and chop. And if you're a young resident, this for case 128 is very good. You can tell it's a resident though, because look, where's the eye? Not in the center of the operating field. See how the eye drifted up there to the top right corner of the screen? It just makes you want to not watch the rest of the video, huh? I agree with you. Me too. So let's end it here. And next time, please, when you send a video in, young residents, make sure, hold yourself to a higher standard. Yes, do a good job like you're doing here, but keep the eye in the center of your operating field. Thanks for watching.